Hey guys, Adria with Stacked Posture here. So today I wanted to talk to you a little bit about stretching and pain in the hips and things like that. I'm pregnant. I am almost 19 weeks, which is really exciting. But if you've ever been pregnant or have somebody close to you who's been pregnant, then you know that there's a lot of back pain, hip issues, a lot of new things coming up for women who are pregnant because of the relaxin, progesterone, things like that. So today I want to give you some tips and tricks to do at home to give you some relief. First, don't do classic stretching, and I'm going to tell you why. So a classic stretch, so say like a hamstring stretch, right? You get on the floor, and you're going to stretch your hamstring. Look where I'm moving from, right? So the biggest place we start to then hinge from is going to be L5-S1, L4, L5 in the spine. And that's where like most all of the disc issues that I've ever dealt with as a massage therapist of over a decade, that's where they happen first, usually. So we want to protect that. So that is not how you stretch your hamstrings. And secondly, when you're pregnant, or otherwise, but definitely when you're pregnant, you don't want to do classic stretching such as that, or even ones that are considered safe as much because of the joint instability caused by the relaxin. So a better way to do it would be getting a foam roller or something like that. Very orange. To be able to then elongate the muscle tissue and work with it that way. My favorite thing to do on the foam roller is going through the thoracic spine, only thoracic, don't do lumbar. There's already too much of a curve there. So you're just gonna go up and down fairly slowly, and that's able to give you a safe and helpful joint mobility without being too unstable. So it's kind of a gentle stretch and help with if you have any extreme kyphosis in the upper back. It's going to help you there. So next, a lot of times I have SI joint issues. So that's that kind of dimpled joint in the back where the ilium meets the sacrum. SI, right? Sacroiliac joint. And I like to get right on the foam roller, right on the very top of the sacrum, but not on the spine. Okay? And you're just going to kind of let it roll a little bit down, and you're just kind of go sinking down, and the goal is to get the sacrum to come back this way a little bit more, because again, we're usually flexing here that way, and that's not where it's supposed to go. The tailbone isn't supposed to be way tucked under. It's supposed to be up a little bit so that the top of the sacrum can start the actual curve of the lumbar spine. Okay, or you can just like kind of sit on it, give it some nice pressure the way it's supposed to go. Something else, you can kind of just sit on the foam roller here. Now I'm just into my glutes a little bit, okay? And just gently rocking back and forth, trying to loosen it up. Now I had it this way, and then again, now you're gonna want to position it to where you can get a better angle for the actual glute. A little deeper, maybe. No. Again, I'm almost 19 weeks, so it's safe for baby. I'm upright. If you feel lightheaded, go lay down. Kind of lift the leg a little bit. Get some activation there. And just goes a little deeper into the glutes. Okay, piriformis, that kind of thing. Lastly, these are just tips for you. There's other things you can do as well. Quads and hip flexors are always really tight, and you're going to want to roll them out a little bit as well. Now, go slowly with this because a lot of people are very tight. Just going right into kind of where it attaches. Not on baby, okay? Just on the leg a little bit. And any movement you do, sorry, I'm out of breath. Any movement you do it really slowly. You don't do a ton of rolling, definitely not on the inside of the leg for pregnant women, because fear of thrombosis coming, blood clots coming detached and then traveling through and causing issues, right? So we don't want that. Don't go crazy. No deep tissue massage on your legs when you're pregnant, okay? But this is just very gentle. You're just getting some weight on it. Just a little bit of rolling really high. Okay, so really high, kind of where all the quads and the hip flexors are attaching. I'm not going super midline. I'm not going really inside of the leg. Just trying to give some release to the quad. And then making sure I'm really turned. They come back to relax onto my heels, okay? Watch out for soft couches, soft beds. That's gonna cause a lot more instability in your hips. All right, you wanna go towards things that are harder and be able to sit well. Check out my video that I've done on sitting. That should help you guys a lot. And my kitty obviously totally wants to say hi. This is Boz. So thanks guys. I hope you enjoyed that. We'll see you next time.